Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to Feel Better, Feel Great podcast, episode 123, Improving Organ Performance Series. This is Medicine for the Heart. I am Dr. Andrea McSwain. As we delve into the podcast, I want to remind you that while I am a medical professional, the information shared here is intended for education purposes only. It is not a substitute for personalized medical advice. Consult with your healthcare provider for guidance on your specific health needs. So in this podcast today, we are going to dive into the world of medical science and holistic health. We're focusing on one of the most vital organs, the heart, and I will discuss conventional and holistic evaluations and treatments, and give you some insights and understanding of the heart itself, and consider the mental and emotional aspects of heart health. Let's first talk about some of the anatomy and physiology. Probably like me, you're very interested in thinking about that. And I think this is a really fun area for me. As an OBGYN, I had to learn a lot of the embryologic structures. It is required to learn embryology in anatomy and physiology in first year med school. However, it's really more of a very intense academic perspective. And I think a lot is lost versus the idea of seeing that formation in part happen via ultrasound and appreciating the details of that in obstetrics and gynecology. So I very much enjoy embryology, the study of the embryo. Well, the heart, like all parts of the body, right? It starts as a tube and then it twists. And then certain parts of the walls dissolve, which I think is amazing, and it turns into 4 chambers. Okay, so when the heart is beating, actually, it's squeezing and twisting. Squeeze and twist. A lot of doctors really start learning about the heart in detail from an adult heart perspective, but it's fantastic to think about it from an embryological development perspective. At least I think so. So then we look at the 4 chambers. Okay, there's 2 on the top, 2 on the bottom, and they're designated with sides. There is the left side and the right side. The left lower part chamber is called the left ventricle, and this is really the biggest pump after the baby is born. So actually, and this is important, and I'll explain why, the right ventricle is the active pump in utero, and it's also the active pump as congestive heart failure starts to develop. Okay, so we'll get into that a little bit later with the pathophysiology. But basically, the other part of the structure of the heart is the electrical system. Now, this is to and from the brain. So again, the heart has a lot of messaging in the electrical system to the brain, okay? And then it has an electrical system within itself in the 4 chambers. And that can get disrupted with things like atrial fibrillation or SVT, any kind of erratic electrical system activity. And then, of course, there are tubes that come out of the heart to supply the brain up and the body down. And as well, it has a blood supply within itself, and those are called coronary arteries. And so coronary arteries are the actual blood vessels of the heart. All right, so that's the structure of the heart. And now I want to get into kind of that conventional evaluation and treatment. So usually people look towards family history, they look towards lifestyle factors like smoking, diet, and then symptoms, like is there chest pain, shortness of breath, difficulty with exertion. And so a lot of things are very vague with that because chest pain for an organ is often a pressure, like an elephant pressing on the chest. And then you'll get some electrical circuit radiation, or you'll get some blood vessel tube constriction, and then that can cause the distribution of the heart problem into the arm or into the neck. Okay, so these symptoms are very, very vague because a hurting heart is a muscle, and so it's more like a muscle ache. And then if it's causing an alteration in how the heart works, then you're going to have an ache that's distributed. And then shortness of breath can often be a cardiac condition. It's now a lot of times also being considered a lung condition, like an adult asthma. And I don't really understand that because most likely it's a heart condition. And then there's physical examinations, including looking at vital signs. And I impress upon you this idea of vital signs because they really matter. So blood pressure, heart rate, breath. When we look at blood pressure and heart rate, I very much have a Goldilocks perspective on this, like not too high, not too low, just right. And we'll talk about that a little bit later. And then listening to the heart sounds as the blood flows through the different chambers. That is a very lost art in a lot of ways. When you listen to the heart, there's different points to gain access to an understanding of how the blood is flowing and how the chambers are responding, both the physical and the electrical aspects of that. When we look at cardiac diagnostic tests, a lot of times people look at the EKG, electrocardiogram, right? An evaluation of the electrical system of the heart. And we can see different arrhythmias and other abnormalities because we're watching the electrical system. The other issue is that we're seeing how the electrical system moves through the chambers of the heart. And so we can evaluate if there's been some physical disruption into the actual meat or muscle of the heart. And that is how an EKG can be very helpful for us. Now, an echocardiogram is the ultrasound use of images and looking at structure and function. And that's a great test. Stress tests, on the other hand, evaluate how the heart performs under physical stress in real time, meaning a stress test is really to evaluate how you handle that stress in that moment. So it has limited value. It's been used for a very long time, but research shows there's not much to be gained from a stress test, and hopefully it will go out of favor soon, especially now because most people can't tolerate the physical aspect of it, and they have to use a chemical in order to stimulate the heart so that the rate increases enough that the stress test can be performed. So before it was a lot of like running really hard and having to get your heart rate up. But now, and for a while, the preference has been to use a chemical to make the heart race and then see how the heart responds under stress. Then look at different blood tests. So if you're looking at cardiac disease, there are definitely things that can happen in the heart that we can monitor. By convention, most people who are getting their blood tests that I see are getting, or I see them get it tested in other areas. It's not the test that I exclusively do because there's a lot more that I think we should offer. But anyway, we check for cholesterol levels. So we usually look at a lipid panel. That's the one that you do when you have a fasting blood draw. And the cholesterol is evaluated by different subtypes and then overall. So that's where you look at LDL, triglycerides, HDL, and then overall cholesterol. So then blood sugar levels. So this is often tested very limited. There are blood sugar levels to look at the normally the fasting glucose, and then also sometimes the 3-month average, which is called hemoglobin A1C. Hemoglobin A1C, like I said, is a 3-month average. We do know how much diabetes plays a role in heart disease. And then markers of heart disease are often completed when people are in the emergency room with chest pain. And those are CKMB, among others. But that's really looking at some significant heart disease. And then, of course, there's x-rays called angiography to view coronary arteries and identify blockages. Okay, let's look on common conditions for the heart. And I'm going to elaborate on the physiology and the pathophysiology. So what is that is good and what is it that's bad? Common conditions include hypertension, which is high blood pressure, coronary artery disease, congestive heart failure, arrhythmias or irregular rhythms, myocardial infarction, which is a heart attack. And that's not an exclusive list, but that's what I want to approach today. So when we look at high blood pressure or hypertension, this is very important because this is very much can be related to stress. So here's my opinion when I check it in the office. I like to get a active blood pressure reading. The actual rule of how to take blood pressure is to sit with your legs uncrossed, no talking for 5 minutes, and then have your blood pressure read. That isn't how you live your life. So if I'm going to take someone's blood pressure, I actually like to do it when they get here and they just got out of the car. So I know how stressed out they are, or I know how they respond to stress. Or I like it just in the middle of the session when we're talking so that I can get a sense of what their active blood pressure is. Now, this is my own interpretation, but I feel like it's really remiss for people to sit quietly, calmly, and no talking for 5 minutes. I think we miss what's actually happening in their everyday life related to their blood pressure. The other issue with blood pressure, just to explain, is that blood pressure is designed to support the fingers and toes, right? We have to have enough pressure in order to have distribution to the farthest ends of our body. And if we look at maintaining a very low blood pressure, we might be concerned with that as an issue. So blood pressure is related to tension, and we want to make sure that we're looking at elevated tension issues, which is hypertension, and deficient tension issues, which is hypotension. And then the other issue with that is we have to have enough pressure to get it to the end of the road. So just think about that. Next, coronary artery disease. So this is when the blood vessels within the heart have a problem. When they have coronary artery disease, then we're not supplying blood to the heart muscle itself. And the heart muscle does not do well if it doesn't have a lot of oxygenated blood. It aches. And when that happens, we have to wonder why. A lot of people look towards plaque, but actually, in the medical community, it's very well known that this can also be due to spasm of the blood vessel itself, which would then reduce blood supply, and then that would cause the heart muscle to be aggravated, thereby causing chest pain. When people have an angiocath evaluation, which is a treatment approach, then for coronary artery disease, if no plaque is found, then the concern is the vasospasm. However, that is not discussed in a lot of times that I hear people talk about after they have been cathed, what is the concluding remarks of the cardiologist or their doctors. Now, that is a pretty paramount component of what is often called preeclampsia in obstetrics, or what I like to kind of boil it down to, which is its very old name, is toxemia of pregnancy. And what happens in toxemia of pregnancy or preeclampsia or eclampsia is very well known to be artery vasospasm. And it applies in coronary arteries as well. So next time, if this affects you or your family member, please talk to the cardiologist about that additional option that this could possibly be a vasospasm, vaso, blood vessel, spasm, that is actually causing the disruption in the coronary arteries. Moving on to congestive heart failure. This topic is really important because we can actually do a lot to prevent it. So congestive heart failure, as you might recall, I mentioned in the discussion of the structure of the heart, because this is where the pump consideration changes for the heart. So in a normal physiologic situation, the left ventricle is the dominant pump. That is the lower left chamber. So when it's the left ventricle, it's forcing the pump out of the heart. And when it forces the blood pumping out of the heart, that is coming from the left ventricle. However, in the aging process, the other action of the pump is to bring fluid up. And the right ventricle starts to overwork when there's a laxity in the body or a fatigue in the muscles, where there's an overworking now of the right ventricle or the right lower chamber to serve to bring up the fluid. That is blood from the venous system. And that is the development of heart failure. That can actually be monitored, evaluated, and treated. And I'm going to talk more about that. Now, arrhythmias are a lot about the electrical system. What feeds the electrical system? Blood. When there are arrhythmias, it's very important to consider that there might be some oxygenation issues to the heart that are causing the electrical system to be disrupted. What is also interesting about electrical system, it's a physical structure. And so if there is compression in the muscles of the upper chest, particularly the left side, or there's consistent shoulder pain, or there's a scoliosis situation, these can impact the actual canals that store the electrical system, and electrical system or electrical cord compression can then cause some misfiring. Now, that is not by convention. That is not a conventional understanding, but I can tell you there's been many times in my practice that I have been able to support the heart by relieving the tension in the musculoskeletal system between the electrical system of the brain and the electrical system of the heart. So it's something to consider, the physicality of that, instead of looking at some of the other outlying situations that might have also play into this, but might be over-exaggerated as to the reason for this problem. And last, of course, is myocardial infarction or heart attack. Now, the heart, so myocardial is muscle heart. Myo is muscle, cardial, right? Infarction is a block, right? And an infarct, an event. And so when this happens, the heart has kind of a long list. So it's had the deck stacked against it. And now the muscle is not getting the blood supply that it needs. And it likely is also due to the nutrition deficiencies of the heart. A very important thing to consider is that the heart is a huge muscle. It's a huge, very thick muscle. It must have really important proteins. It must have really important mitochondrial support like CoQ10, because the heart muscle has a lot of mitochondria, which is the power plant of the cell, because it has to produce a lot of energy. So looking at this from a nutrition deficiency perspective is very important, because we want to make sure that we're fueling the heart. The other thing that's really paramount is thinking about how much it takes in cholesterol to repair muscles and any kind of tissue that's been damaged or having problems. So a lot of times we think about lipids and cholesterol as bad, but there's a very important study in the Journal of Critical Care Medicine in July of 2014 indicating that LDL of 110 is the absolute lowest amount, because there's a clinical and statistical significance of death after heart attack within 30 days of those patients in the ICU if their LDL was less than 110. And so I'd really impress that upon you is an important consideration. The other thing that's really important here is thyroid support, because the thyroid very much supports the way that the heart works. And so if there's a significant thyroid dysfunction or a sustained thyroid dysfunction, then we're really looking at how much that impacts the heart. I do want to take a quick moment to go back to high blood pressure, or to go back to blood pressure, just so you understand systolic and diastolic. So systolic is the top number, and that is the squeezing pressure. And the bottom number is the diastolic blood pressure, and that is the pressure while the heart is resting. They each give us different information. In my opinion, one is neither more important than the other. I know that often swings on the pendulum of medical priority, but honestly, you want to make sure your resting blood pressure, which is the bottom number, and your squeezing blood pressure, which is the top number, are both good and both effective, and that the space actually between them is the arterial pressure. So knowing those numbers as you understand blood pressure, and I'm not going to elaborate on this today, even though it's fascinating, but asking these questions and actually understanding blood pressure, if you have that as an issue, is really important. All right, I'm going to cruise into some other treatment approaches by convention. So medications are given. A lot of people are on antihypertensives or medications that lower their blood pressure. Okay. If you are on a blood pressure medicine, you might consider looking at the 2013 antihypertensive guidelines because they actually have a huge research study that shows blood pressure based on different decades. The ideal blood pressure, in my opinion, in a very brief summary, is 120/80. And yes, you can get into a lot of minutia there, but I would say if you understand 120/80, it's very important. That is in a healthy 40, 50-year-old. As you start getting into 60s, 70s, 80s, your blood pressure will need to increase because you have to get blood to your brain. Because if you have little blood to your brain, right, then you will reduce the blood supply to your brain, and that does a few things. One, vascular dementia, and two, increased risk for falls. So that is how the 2013 antihypertensive guidelines worked, is they actually stratified by decade, and they looked at the whole person to understand what the priorities were. MetLife did a longitudinal study and looked at hypertensive levels and longevity. So MetLife insurance has a ton of data, and they really found men who were 50 who had a blood pressure of 150/90 had a 21-year life expectancy. Now, that is lower than the national average. That would be 71. And this is actually a very old study. I can't cite the year, but I can tell you that it was done quite a long time ago. So that might have been also an impact onto life expectancy. But you have to realize it's a 21-year life expectancy if someone's 50 and their blood pressure is 150/90. And that's high. So we want to look at actually what blood pressure means as from the whole person. Okay. But anyway, we're talking about medications and treatment approaches by convention. So now I'm going into statins. Statins lower cholesterol with the thought that this reduced plaque formation will then reduce coronary disease. However, there's also magnesium that lowers plaque formation. So that's something to consider. And then also another consideration is that statins thin the blood. You need to know that. It's a blood thinner. The other issue is that they deplete the muscle integrity because they lower CoQ10, which is part of the power plant of the cell. So anticoagulants, so if someone has electrical system disruption, they can sometimes use a medication to thin their blood. So they anticoagulate. They don't coagulate or have spots where their blood pools and then it clots. That's particularly done in a few places in the heart and then also usually more distally in the legs. And that is a DVT, so which is a thrombosis. And occasionally those clots will make it up into the lungs. But anticoagulants interfere with the clotting cascade. There are many ways to anticoagulate or thin the blood in a healthy way. Beta blockers and ACE inhibitors for heart failure. We look at beta blockers, they slow everything down. And so it's really important to consider that if you feel like you have someone pushing on your head while you're trying to get stuff done in the day, that could likely be the effects of a beta blocker. And so they slow the whole system down in essence. And that includes not just the heart, but also the lungs. I really think about heart failure as a pump issue, and there are a lot of ways to support the pump of the body. Other lifestyle modifications that are included often when people talk to conventional doctors about their heart disease or risk for it is a wonderful plant-based support by Dean Ornish. There's also a wonderful integrative cardiologist in the Detroit area, Joel Kahn. Lansing is also blessed to have Alicia Williams, and that is amazing if you can find an integrative cardiologist. But they're often looking at plant-based, Now, if you don't have heart disease or you're very low in lipids, you have to be concerned about that. But Dr. Dean Ornish did some fabulous studies just looking actually at how really animal-based foods were quite difficult on the heart. Smoking cessation is encouraged, but what has to be known is that you have to stop smoking. You cannot restart. And this is very important because it wreaks havoc on the coronary arteries. So if you stop, you have to stop. And so that's an interesting conversation that a lot of cardiologists and primary care doctors don't have, because they're saying, okay, well, just stop. But you have to really commit to not restarting. And of course, looking at blood sugar control and weight management. I hate to say it like that because I think a lot of people are just told to go lose weight. And obviously, they already know that. So why are you telling them if you're not giving them resources to help them, right? So I don't put that on people. It's definitely an important consideration, but it needs to be discussed in a little more comprehensiveness to be supportive instead of a punitive comment. That's why I don't like it. But anyway, it is important to discuss. Surgeries by convention, angioplasty, stenting to open blocked arteries. Sometimes there's actually a bypass grafting for severe blockages, and then a pacemaker implementation if there's electrical systems. There's also a few other things that are discussed, especially for people who have arrhythmias and they're on a blood thinner after a while. There is a like a little flap on the heart, and you'll have to excuse me, I can't remember the name of the procedure, but it's actually to remove that appendage of the heart or to block it. And I have to say that there has been a resurge of interest in this. About 15 years ago, this was in favor, and then it was out of favor, and now it's back in favor. There's some beautiful marketing materials on this, but there is no basis for it whatsoever in the evidence. When I pulled the literature, when a patient brought me this really big, shiny brochure, and I said, here is the information, and it is not a helpful procedure. And I really don't understand the idea of cutting off something from the heart. So please consider that and actually ask, that's my take home point for this. Whenever there's a procedure or a surgery, what are the benefits? Because doing something like this, you can't go back. You can't add an appendage, right? There's just things that need to be considered that really are important when looking at procedures and surgeries, no matter what, but particularly for the heart. Okay, so I kind of, didn't exactly follow the best structure with that because I wove in a lot of my thoughts. I hope you realize sometimes when I say those things are my thoughts versus, strict evidence from the medical literature versus some things just to think about. And then some insights as well of being a doctor and working in the healthcare system. So I can help you kind of translate what's being said to you when you are working with your doctors. But I do want to spend a few minutes shifting to the part that I feel is more important about the heart, which is a holistic approach. Obviously, when I see a patient and they have a heart condition, I'm obviously looking at a detailed history. So diet, lifestyle, emotional stresses. I look at what's gone on since sometimes before they were born. There's a very sad, unfortunate story of a man who born in a concentration camp and the emotional toll that took on him. And he wasn't even born yet. So that is something that's called an antecedent, things that happen that are stressful before we're born. Then those mediators are kind of those long-term stresses that just kind of eat at us. So when people are having an organ dysfunction, particularly with the heart, what is it that's just really consistently aggravating? Then what is it that is acutely aggravating? So what are the triggers? So a trigger is a very neutral thing for most people, but for you, it just sets you off. I can tell you that when you think about triggers, that can often be where people are often set off when they get cut off in the car. But some people learn to actually not be stimulated by that. They just recognize that might be slightly uncomfortable for a moment, but it can be resolved and it doesn't become aggravating. That's probably not the best example, but there's a lot of things that might set you off that are really important for you to recognize that that is causing a stress and that needs to be balanced, kind of reorganized in the background messaging of your body. Second is obviously stress levels. And I'm not someone that says you shouldn't have stress. I think we all have something to offer the world. And sometimes how we offer it and when we offer it isn't always balanced into a 40-hour work week. It's often doing something for a community that requires a lot of attention and a lot of dedication. And then, how much is that taking a toll on you? And then when do you need to step back and let other people support that? So those are some things that I look at and how I evaluate stress. I don't think that stress should be absent in our lives. Sleep patterns. So for people who are waking up at 2:00 in the morning, they need to recognize that that is affecting their hormones and it's also affecting their heart. And overall, where's the joy? Like, where's your overall well-being? Is there joy? Is there laughter? Is the chest moving because you're laughing so much? Because that is a very important metric in our life. Okay, and then I like to use diagnostic tools. So I use advanced lipid profiles, inflammation markers like hsCRP. Sometimes I look at sed rate. I also like to look at actually the blood vessel integrity to see if there's a vasculitis, so a vascular inflammation. And remarkably so, I like to consider the idea that this is a cardiovascular system that the heart is a part of. We're obviously talking about the heart today as an organ, but I just want to remind you that we're also always thinking about the vascular or blood supply. And we want to look at how thick are those blood vessels. And I don't want to base it on inference of someone's cholesterol levels. I actually want to look at biomarkers that have been around for nearly 20 years that actually tell us how much inflammation, calcification, plaque formation, and also how much blood thickening is happening. And these markers include LPPLA2, MPO, hsCRP, and fibrinogen. Those are among many, many important biomarkers. I also like to assess CoQ10. I like to look at the stress-mediated response and its impact on blood sugar. So in addition to hemoglobin A1C. And then I like to look at statin myopathy genes. What person is susceptible to statin myopathy? So muscle pain related to taking a statin. Well, it's estimated that this gene is present and positive in 43% of people. So if you are really aching while taking a statin, it might be a genetic profile there. Then you can look at blood thinning genes, and you can look at warfarin resistance or warfarin vulnerability. So those are some diagnostic tools that are readily available. And I hope I mentioned CoQ10. Then looking, of course, at, the standard holistic treatment that a lot of people see. Obviously, your lifestyle pillars. What are you eating? Do you have enough omega-3s? And this is also a really significant biomarker that I test. This is coming from fish, nuts, seeds. Very important. How much sugary drinks are you drinking? So how much caffeinated and sugary drinks are you drinking? A lot of people do not enjoy the taste of water. And so I encourage you to add things like lemon, raspberries that you can mash up, or mint leaves, or, a greens powder, and look at adding that to your water instead of a commercially processed water substitute that is often loaded with artificial sweeteners, which wreak havoc on the body in general. Not to mention the preservatives, the dyes that are in there. So if you don't like water, fine. Just mask it and use actually a way to support your drinking habits that are related to actually getting in the water, but using some nutritional and herbal supports with that, as I mentioned. CoQ10. Absolutely a must for energy, for muscle integrity. Remember, the heart is a huge muscle, and absolutely paramount for a statin. I recently saw a new patient who has been on a statin now for 3 years. ironically has not had their lipids tested for 3 years and had severe muscle pain with one statin, was switched to another statin and doesn't feel the muscle pain, but is having a terrible time with recovery from injury. So we know that the mitochondria is compromised, even though the pain isn't necessarily there from the muscle aches. Critical for blood pressure regulation, absolutely, and also plaque thinning is magnesium. Magnesium is used in obstetrics to lower blood pressure in cases of toxemia/preeclampsia. Then we look at mind-body practices. What are you saying to yourself every day? And that is very important. So when we look at heart health, I want to tell you about an emotional link to heart health called HeartMath. HeartMath is reorganizing the messages of the heart to the brain. And there are many, many fibers going from the heart to the brain. HeartMath is a very simple technique and series of techniques that has over 400 research articles. I would like to encourage you to listen to Dr. Deborah Rosman's TEDx talk as she discusses HeartMath. She explains how the heart can give message to the brain, and this changes your background loop. And it really can change chronic stress, anxiety, and depression. And these all have an impact on your heart health. And then, of course, there are a lot of other ways to consider your emotional well-being. I happen to be a huge fan of HeartMath. There's so many other things I want to say, but I just feel like today we had a really good opportunity to discuss the medicine of the heart in this idea of improving organ performance. I really hope today that I offered you some information and some insights, both from the science of medicine, medicine by convention, and then a broader picture of how your heart can be healed by looking at its function and more than the muscles, but also the electrical system and the emotional, mental, physical dynamic that plays out in the heart as well as all the other organs. Thank you so much. We'll have some really good handouts for this one, and I can't wait to share it and ask you to share it as well. Thank you so much.